As many of you know, this Friday, the state's mask mandate is set to expire. We've been very careful from the beginning of this pandemic to take up items individually and make informed decisions. We never set arbitrary dates unsupported by data or science. We look at each step to determine if and when we must renew our temporary restrictions. Tomorrow, New Hampshire will not renew the state's mask mandate. We'll continue to work hand in hand with public health to encourage social distancing and wearing of masks when appropriate. That message will not change whatsoever. What does change is the government's imposed requirement to do so. So the key data points that we continue to monitor, we can talk a little bit about those so folks understand what we're looking at when making these significant decisions. So first we have the rate of the COVID-related fatalities. So what you see here, what we're showing here is this is the 7-day average of fatalities in New Hampshire since November 1st. And as you can see, this is that fall and winter surge that was just so tough across the state of New Hampshire. At one time, averaging just about 12 fatalities a day. Really, really tough time in late December, early January and February. You can see this is when we began our mask mandate. We didn't have vaccines at the time. We were coming into what we knew was a predicted surge. We obviously hit the surge. And now if you see on the other side where we are today, ending the mask mandate on April 16th, we are down to approximately, we still average about 1 fatality a day. And of course, one is still too many for all of us, and we acknowledge that. But with over a 95% drop in fatalities, vaccines being so readily available, especially to those most vulnerable, this is really what we had put the mask mandate in place to protect for. And it worked. It really did. I can imagine these numbers could have been a lot worse without some of those additional restrictions in place. And we appreciate the sacrifice a lot of folks made. We know it wasn't always easy for folks, but we will be ending the mask mandate on the 15th. The hospitalization rate. Also, I don't know if we have a chart for that one. While that one isn't dropping so much, we don't have the concerns that we had before concerning our healthcare system being overrun, lack of available beds. There's plenty of beds available throughout our system. Loss of hospital services. There was a concern that hospitals may have to pull back on their services. The workforce shortages that we saw back here in November, December, January, a real critical time for healthcare workforce. But now that we've been able to get them the vaccine, a lot of those folks are back. They're working in the hospitals, and so there isn't nearly as big of a concern, or really any concern, that the system is going to be overrun, especially as we go further and further down the road with vaccines. And speaking of vaccines, there's also the vaccination rate, a huge variable that, again, didn't even exist back in November when we put these mandates in place. What we're seeing here is a lot on this chart, but it's a really good chart. So this is back on December 15th, really when we first started receiving vaccine into the state, all the way to today. So the first thing we did was allow the folks in long-term care and our healthcare workers, those are our most vulnerable populations, to receive the vaccine. And you can see each step that we took, expanding the eligibility for folks to get vaccinated. 65 and up was starting back in late January. A couple months ago, actually. Then we did teachers, and 50 and up, 40, 30, 16 and up. And you can see the rate of vaccine distribution. Folks know we are among one of, if not the best in the country. We are really on the tops in terms of the speed of vaccine, and really what has happened over the past month has been an absolute game changer. And Perry Plummer and Beth Daly and the entire team deserve so much credit for allowing this next step to really take place. The white line you see here are those that have been fully vaccinated, the number of citizens that we have. The yellow line is those that have at least gotten a first shot. And those right there, those numbers total nearly 1 million people across the state, or 1 million shots administered. Which is just a phenomenal number, something that I don't think any of us really thought possible just a couple months ago. But it's going super fast, which is wonderful, which is why that fatality rate is so low, and why I think we can have such flexibility moving forward. It's important to note that this mandate going away will not limit or prevent the ability of a private business or local cities and towns from requiring masks, as was always the case before the statewide mask mandate came into place prior to the fall surge. Also, a state mandate does not have to be in place for simply us to know that wearing a face covering when we're unable to maintain social distancing, it's just a good idea. It's recommended by public health. We're strongly behind that message, and we encourage everyone to continue to do so. New Hampshire residents, I think, over the past few months have shown that they know how to keep themselves, ourselves, our neighbors, our communities, our families safe without a state mandate in place, as we did before the surge. And it's a good reminder to remember why we did this in the first place. Back in November, again, our most vulnerable population wasn't vaccinated yet. We were heading into what we predicted to be that tough surge. Long-term care residents were at grave risk. We saw those numbers escalate, and we needed to insulate those individuals. But now that that population has had more than ample time to receive their vaccine, we're just thrilled that, by and large, they have chosen to do so at such a high rate, which gives everybody, I think, a good pause and a breath that we really are coming out of this very, very quickly.